name's Sarah Jarman and I'm clinical educator for EDs here at Mid Yorkshire. Really sorry that I can't be at the celebration event with you all, but I'm just about to go off and have my baby, so I've done a little video for my project instead. So my project is to launch the RCN Emergency Nurse Competency Frameworks for emergency nurses. And I'm going to demonstrate how we're going to do this using the GROW model. So the goal of this project is to introduce the RCN Emergency Nurse Competency Framework for ED nurses. And this document's used in other EDs up and around the country, and it's a nationally recognised document which outlines lots of skills and knowledge required of ED nurses. This will replace the Band 5 Inpatient Competency Booklet that Mid Yorkshire have produced. So the reason for doing this is because the inpatient booklet is not quite specific to ED, and it doesn't reflect the skills and knowledge that ED nurses need and have. And due to the nature of ED, it takes into account the resource skills that we have, minor injuries, competencies. It looks at how we look after children, patients with mental health needs, so it's just a lot more specific to skills in ED, and it acts as a passport then for our nurses, that they can demonstrate a lot of the emergency nurse skills that we have. So the options were, so we could create a new booklet that incorporates the Mid Yorkshire ED nurse requirements, or we could use the RCN Emergency Nurse Competency Booklet as well as additional competency booklets that the RCN Competency Booklet does not contain. So that is things like sepsis, medicines management, insulin requirements, and manual handling competencies. And what we've gone with is combining some of the ED, the whole of the RCN Emergency Nurse Competency Booklet by the RCN, and a few of our Mid Yorkshire competencies that were missing from the RCN booklet. So who do we want this to be aimed at? So this booklet will be aimed at all registered nurses in ED. So this does depend on individual experience. So nurses who have got 18 months qualification or less will be at level 1 nurse, and those who've got 2 years or more will be at competency level 2 nurse. And we can then split our roster, and that can demonstrate skill mix within the department. And our time frame is within the next 12 months. So this has already been rolled out in the department, and we're just monitoring how it's going at the moment. I've also done a bit of a plan, study, do cycle, just to demonstrate what I've already done and how it's going in the department as well. So the plan, obviously, as I've already said, ED needed a specific document that covered all the skills and knowledge that ED nurses have to work with an ED setting. And as I've already said, the RCN document was a nationally recognised document that other EDs were using, so we needed to get onto the same path as other EDs in the nationality. So it does replace the inpatient competency document, which was not specific to ED. And as I've already stated, the level 1 booklet is for those who have worked in ED or been qualified less than 18 months, and the level 2 document is for those that have qualified more than 2 years. So what I did was created the document. So I used the whole of the RCN document, and I pulled out parts of the Band 5 inpatient document, which was a Mid Yorkshire Trust competency booklet and combine the two. So again, it takes into account Mid Yorkshire specific competencies, but it also has the full RCN booklet in there as well. And this, we needed to do this because some of the parts that we do in our trust are a little bit different or additional to what was already listed in the RCN booklet. So I've prepared and designed the booklet, adding the parts in that we needed. I think as well with any change, it's important to include the nursing team, so I gave them regular updates about the new competency booklet. Try to sell it in a way that this was one document instead of having a few different competency booklets. The document was one piece of competency that they needed to do. It went through our clinical governance and it went through the nursing and midwifery group to get passed, so that then they were in agreement and we could use that and launch it in our department as well. So we launched this in January. We had mixed feedback. Obviously with any change it's a little bit difficult at first, but once we've given them education and an understanding of